Hi everyone. Recently, WHO stopped the trials on hydroxychloroquine drugs and Lopinavir. So you may be knowing that this hydroxychloroquine is a drug which is used for malaria treatment, and this Lopinavir is used for HIV patients. So they have the WHO has been using this drug earlier because there were some experiments which um, showed that these drugs can block the SARS-CoV-2 viruses which causes COVID-19 disease. But this effect has not been replicated in the rigorous trial later in the people. So because of that, and the solid reason is that they are saying that there is no reduction in the mortality of the hospitalized COVID-19 patient when compared to the standard care. So because of that, they have stop the trials on this hydroxychloroquine as well as the lopinavir. Okay, so this recommendation come from the Solidarity Trials International Steering Committee. So they recommended that should discontinue the trials on hydroxychloroquine as well as lopinavir. So based on the recommendation, WHO is now will be discontinuing the trials on the hydroxychloroquine and lopinavir. So if we are checking on solidarity trial, they have 5 sections of researches going on, because at present COVID-19 is striking the world. So WHO has been carrying out different kind of trials. So one is by solidarity trial, and so they have 5 sections. They are doing research in 5 sections. Like one is standard care. So in that they will be focusing on the standard care given to the patients, and they will be making some of the modification on the care given to the patient, and based on that they will be doing research. Then another one is, or the second one is on the remdesivir, and third one is on hydroxychloroquine, the fourth one is on lopinavir or ritonavir. Both are AIDS drugs. Then fifth one is a combo, that is a combination of lopinavir or ritonavir with interferon. So such a kind of researches are going on. So based on that researches and recommendation of the Solidarity Trials International Steering Committee, so far for the time being they have stopped the research on this hydroxychloroquine. Okay, even though earlier they found that this is able to block these viruses which caused COVID-19, but now it is found that this drug is a bit ineffective. Okay, so the impact of this decision will be like temporarily there will be drop of hydroxychloroquine from the global study into the experiment of this COVID-19 treatment, because there is a need of experts review on the available evidence. But the WHO has crystal clear said that this decision only apply to the solidarity trials in hospitalized patients. So they are going, or they are carrying out the trials in hospitalized patients. So they will be stopping these trials in this hospitalized patients only. So rest of the people can use this still. So they are saying is that this doesn't rule out its use in other studies to treat non-hospitalized patients. So we have to focus that WHO is only recommending to stop this trial on hospitalized patients, which means that we can use still this for the treatment of non-hospitalized patients, or as a pre or post exposure preventive treatment for this COVID-19. Okay, so we have been using this hydroxychloroquine for the prophylaxis, pre as well as post exposure prophylaxis. So in that case we can still use this drug for the treatment, but in the case of hospitalized patient, they are saying that there is no need to continue the drug. Okay, so this is what is the decision by the WHO, and they have already said on what basis they are discontinuing this drug. So that's all about this. Thank you.